Hi, my name is Kennedy Sexton, and today I'm going to be demonstrating starting a peripheral IV. I'll make sure to follow all GPSP, follow my 11 rights, and do my 3 medication checks before giving any meds to my patient. So first I'm going to knock. Hi, my name is Kennedy. I'll be your nurse today. We're going to start an IV on you. Can you tell me your name and date of birth? Everything matches. Do you have any allergies I need to know about? They don't have any allergies. And is there anything with this arm or your veins I need to know about before we start this IV? He said no, so we're going to go ahead and get started. I'm going to perform hand hygiene. All my supplies are within the expiration date. Everything is clean and dry per the packaging, and we're going to go ahead and get started. I'm going to get my tubing out. My solution. Take this off. Spike. And we're going to hang. And we're going to make sure our chamber is halfway full. Okay, that looks good. Now we're going to make sure there's no kinks in our line. All the tubing looks good. Okay, now we're going to unclamp and uncap. Make sure the line is primed. I'm going to recap. And I'm just going to hang this. After I reclamp my line, I'm going to hang this and we're going to leave it up here until we're ready to use it. Alright, now we're going to prime our J-loop. I'm going to perform hand hygiene. Here I've got my saline flush. Take the cap off of that. I'm going to open my J-loop. I'm going to make sure I follow, keep everything aseptic. Twist my saline on there. I'm going to make sure this is unclamped, uncapped. Prime my saline. Okay, then we're going to clamp this. And I'm going to place this back in my clean container until we're ready to use it. Alright, now we're going to move over here. I'm going to assess my patient's vein. This arm looks good. There's no scar tissue, no complaints at this time. So now I'm going to tie my tourniquet. Okay, I'm going to tie this about 3 to 4 inches above where we had picked our spot. Get that there. Hand hygiene. Put my gloves on. We're going to check his radial pulse. Okay, everything feels good. Now we're going to clean our site. Up and down. Making sure it's thoroughly clean. Throw that away, and I'm going to let that air dry. Take our catheter here. I'm going to hold the skin taut, and I'm going to advance. Let's see. Okay, got blood return. I'm going to keep that catheter in. I'm going to hold pressure. Take this, pop my safety, put that in the sharps. Okay, then I'm going to get my tape. We're going to tape this down. I'm going to pop my tourniquet. Okay, still holding pressure. I'm going to get my J-loop back over here. I'm going to attach, unclamp it, and attach to my catheter. Okay, now we're going to take our flush and we're going to release. I'm going to push forward and I'm going to pull back, making sure I have blood return, and then we're going to flush, checking for any infiltration. This full syringe. Okay, everything looks good. I'm going to lay that there. I put Tegaderm over this side. Making sure to clamp this back off. I'm still assessing this site, making sure there's no pain, no abnormal swelling, infiltration. I'm gonna remove my saline. I'm gonna tape this up. And then I've got my label here, and I'm gonna make sure to label with my name, or my initials, the date and time. We're gonna put the size that I used, the gauge, and where it's at. Make sure that's all labeled accordingly. All right, so now that that looks good, we're going to start our IV solution. We're gonna get our primed line from before. Take this off. Scrub the hub. Scrub this hub. Insert. Okay, make sure everything is unclamped. Alright, looks like we're running good. No infiltration at the site right now, no pain. My saline's running good. My pump is set to the time and to the order, the medication order. So I'm gonna perform hand hygiene, make sure my patient doesn't need anything, make sure that there's no infiltration, and then I'm gonna leave and I'm gonna come back in about 30 minutes and assess the site, make sure there's still no infiltration, my patient's having no pain, pump's working good, and then I'm gonna report and record.